يعطيكم العافية. أول إشي رشا ممكن تأكدي لي إذا شايفيني، ممكن تكتبي كومنت. أو أي حدا من الموجودين، بس إذا ممكن إنه عشان أتأكد إنه الأمور تمام. تمام، واضحة الصورة وشايفيني صح؟ وسامعين الصوت كويس أهم شيء. تمام، كيف حالكم؟ إن شاء الله تمام. أول شيء يعطيكم العافية جميعا، إن شاء الله تكونوا لكم صحة وخير. شكرا لكم إنه اليوم أنتم معنا في الويبينار. حبيت أسلم عليكم بالأول. هلا راح يعني نغير الكاميرا وبحيث إنه نعرض الهاند أوت بشكل كامل عشان يكون واضح. لكن إحنا ممكن بعد ما نكمل خلينا نحكي الموضوع نفتح زي أونلاين ديسكشن. راح أرجع لك الكاميرا، وإذا حدا عنده أي أسئلة أو يعني if you want to ask any question or raise any point. تمام، فهلا راح أغير الفيو تمام بحيث إنه على الهاند أوت مباشرة. أوكي، بتخيل هيك أوضح للكل. تمام. اوكي. اوكي سو راح احاول احكي يعني اغلب الحكي بالانجليزي since انه some of our يعني Malaysian colleagues are friends. I know they are joining today, so I try to stick to speak in English. اوكي، لكن اكيد يعني راح احاول كمان اوضح بعض المصطلحات باللغه العربيه، لانه في ناس non-dental practitioners كمان موجودين معنا اليوم. بالتالي راح نحاول انه نوضح اهم النقاط both in English وباللغه العربيه. تمام. مره ثانيه good afternoon everyone. I hope you are all well and safe. Today we are going to talk about coronavirus disease. Our lecture is COVID-19 outbreak, current and future guidance and precautions in dental practice. Now, as you know, this disease has become a major health problem for mostly all the countries in the world. The World Health Organization announced it as a pandemic since that it has spread in nearly all the countries of the world. Now, if we want to talk about the fatality rate, it's not considered that high in comparison with other infectious diseases. We are talking about يعني maximum 3 to 4%. لكن what is really worrying about this disease that it spreads really fast among people. It's highly contagious, and this is very serious and critical. So we need to take extra protective measures and to be very precautious. And as dentists, we need to follow very strict infection control measures to prevent and control the spread of the disease. في شغلة قبل ما أبلش بالأوتلاين. I would like to thank Jads for the invitation. نسيت أحكيها، كان لازم حكيتها بالأول. So thank you Jads for the invitation. Thank you Rasha, Dr. Rasha, Dr. Ruba for helping me in the setting up of the online webinar. كمان Dr. Rasha, actually it was her idea. So thank you for the creative idea and for the invitation. And thanks again everyone for joining the webinar. Okay, so we'll start with the outline. We'll go through the following points today. Introduction, origin and characteristics of novel virus. How does the virus enter or attack the body? Diagnosis and treatment of the disease. How the virus is transmitted. and then we will give, like say, more focus on the possible transmission routes of the virus in dental practice, and then what should dentists do, and we'll talk about our role in the control and prevention of transmission of disease, which, as we will see, is going to be a very important role, since that there is a high chance for the transmission of the disease in the dental practice. We'll discuss many infection control measures that can be followed to prevent and control the transmission of disease related to patient evaluation, hand hygiene, personal protective equipment, mouth rinse, rubber dam isolation, four-handed technique, extraoral X-rays as alternative to intraoral, disinfection of the clinic setting, and management of medical waste. Then we'll talk about the list. We'll go through the list of dental emergencies and urgent cases according to the American Dental Association that we can treat during the pandemic, recommendations for dental education, and finally conclusions and references. راح ارجع هلا لانه انا بكون هلا شايف بس اللي هو الهاند اوت، بدي اتاكد كل شيء تمام يا جماعه لحديت هلا. يعني انتم عم تسمعوني وعم بتشوفوا الهاند اوت. Can you hear me well, and can you see the handout? Can anyone reply in the comments, please? Okay. So can anyone reply again? Yes. Okay. So if everything is clear, okay. You can hear me and see the handout. Good. Okay. Good. Okay. So we'll start with a quick introduction or a brief introduction. We know that like the virus started, or the spread of the virus started in Wuhan, China, in December. The first announcement about the virus was by the Chinese Center for Disease Control and Prevention, and that was in January 8, when they announced that there is a novel coronavirus causing a viral or a severe type of viral pneumonia, later called coronavirus disease. So, as we all know, the epidemic of coronavirus started from Wuhan, China, in December 2019, and very quickly spread to all over the world, actually, and to all the countries of the world, and now became a major challenging public health problem, definitely not only for China, but for all countries around the world. In February 11, the World Health Organization named the novel viral pneumonia as coronavirus disease, COVID-19, and they announced it as a pandemic on March 11. طبعا احنا هنا بنحكي عن pandemic، لما نحكي عن epidemic بنكون نحكي عن وباء، لما نحكي عن pandemic بنكون نحكي عن جائحة، بمعنى انها اجتاحت كل دول العالم. Unfortunately. Today, as of March 30, COVID has been recognized in more than, or in 199 countries, which means all the countries of the world, and with a total of more than 700,000 laboratory confirmed cases and nearly 34,000 deaths. Okay, let's try first to understand better the virus. Where does it come from, or what's its origin, the characteristics of the virus, how does it enter the body and invade the body, and what are the main clinical manifestations and complications associated with the disease. First, it's interesting to know that the virus that causes COVID-19 disease is from the same family that caused severe acute respiratory syndrome, SARS disease back in 2002-2003. So they come from the same family. They are both coronaviruses, and so some people called this disease in the beginning as SARS coronavirus 2. Okay, so they both from the same family, and from the same type actually of the same genera of coronaviruses. They are zoonotic, which means that the first transmission will be from animal to human, and then from human to human, but the first transmission was from animal to human, and that's why we consider it as zoonotic transmission. The most probable origin for the virus is horseshoe bats, Chinese horseshoe bats, but pangolins were also found to be intermediate hosts of the virus, and actually the evidence now supports that that most likely transmission of the virus to humans, not from horseshoe bats, but from pangolins, because when they did genetic matching, they found that the coronavirus in human body is nearly typical of that and identical to the one in pangolins. About coronaviruses, it's interesting to know that there are 4 genera of coronaviruses: alpha, beta, gamma, and delta. Most of the coronaviruses can cause infectious diseases in humans and vertebrates. Alpha and beta mainly infect the respiratory, gastrointestinal, and central nervous system in humans and mammals, while gamma and delta mainly infect birds. Okay, so how does the virus attack the body? The virus will enter the body when someone inhales it, or when we touch a contaminated surface, and then the mucous membranes of our eyes, nose, and mouth. So we'll talk in more detail about the transmission of the virus, but what we need to know now that the virus, we can inhale it, or it can get into the body or enter the body through the mucous membranes of the eyes, the mouth, and the nose. Now, the coronavirus in general structure has something we call it spike proteins. We can see it here in the membrane of the virus. We can see it here as indicated by these purple triangles. So the spike proteins in the membrane envelope of the virus will enable the virus to bind to angiotensin converting enzyme 2 receptors, okay, in the host cells. Now, this type of receptors is abundant in respiratory cells, and this explains why the virus mainly affects the respiratory tract, because the main host receptor is ACE2 receptors, angiotensin converting enzyme 2 inhibitors. These receptors are abundant in respiratory cells, and through the spike protein in the membrane envelope of the virus can bind to these receptors and then invade the respiratory cells. Of course, after the virus enters the body, the symptoms will not appear immediately. There will be an incubation period, long incubation period, and this is one of the things that is really bad about actually this viral infection, because it might take up to 14 days incubation periods before symptoms start to appear. And this means that we might miss many infected patients, and the transmission of the infection can spread and can be faster, because we can't identify the infected patients during the asymptomatic period, unless of course we confirm the infection with a laboratory test. Okay, so the main symptoms of the disease after the immune system starts to react to the virus after the incubation period, which as I just mentioned, it can take up to 14 days. So the main symptoms are fever, dry cough, usually the cough is dry, not wet or reproductive, myalgia, muscular pain, fatigue, and most of the patients who underwent chest computed tomography abnormal bilateral pneumonia was found. So it's one of the important findings, the appearance of bilateral pneumonia in chest CT scans. And actually, this is one of the, let's say, serious complications of the disease. And if it gets severe, it might be the reason for death. Less common symptoms like headache, sputum production, hemoptysis, coughing, blood, and diarrhea. اوكي راح ارجع كمان مره واشيك انه الامور بعدها تمام. الكل معي؟ اذا ممكن كمان حدا يكتب لي كومنت ياكد لي انه الكل شايف وانه مع بعض بعدنا تمام. يلا ابعثوا لنا كومنت please reply or post a comment just to confirm that everything is going well. Thanks, Liam. You are always there. Thanks, Rania. Okay, so as we mentioned, the symptoms will start to appear after nearly 2 weeks incubation period. Diagnosis and treatment. The diagnosis can be based on epidemiologic information, history of travel to affected areas, up to 2 weeks, clinical symptoms, mainly fever, cough, myalgia, as we just discussed. CT imaging finding, the appearance of bilateral pneumonia in CT scans, and the laboratory or the agreed laboratory test for corona or COVID-19 disease is reverse transcriptase polymerase chain reaction, RT-PCR test. However, we need to point out that laboratory test RT-PCR can be false negative sometimes. So if the result is false negative, this doesn't completely rule out or exclude infection because there is a chance of error in the test. We need to always rely on the epidemiologic information, symptoms, the imaging findings, and the test to confirm, diagnose the disease or rule it out. Regarding treatment, so far there is no evidence from randomized controlled trials to recommend any specific anti-novel coronavirus treatment. So the management has been largely supportive by controlling the fever using antibiotic medications and by giving the patient liquids in order to prevent dehydration. So the treatment is mainly supportive. Trials on medications such as remdesivir, which is a broad antiviral drug, hydroxychloroquine, a drug or a medicine used for the treatment of rheumatoid arthritis, and chloroquine used for the treatment of malaria. Some trials are going on these medications. Perhaps the most promising results so far are for chloroquine, the one which is used for the treatment of the malaria. But until now, there is no randomized controlled trial to confirm the effectiveness of this medicine in treatment of the COVID-19. Okay, transmission route of novel coronavirus 2019. We have 3 main ways for the transmission. Direct transmission, contact transmission, aerosol, and fecal oral transmission. In direct transmission, here we need we mean the transmission of the virus with inhalation or via or through inhalation. So when an infected patient coughs or sneezes, they can produce droplets. These droplets will contain the virus, and if a susceptible individual inhales these droplets containing the virus, they will get infected. Okay, so this is the first way of the transmission of the disease, contact transmission, which can be direct or indirect. When it's direct, here I mean that the droplet, again containing the virus, directly contacted the mucous membrane of the eyes, nose, and the mouth, and so the virus entered the body through these mucous membranes. Indirect, we know that in the end the droplet will fall into ground or surfaces. So if someone touches these surfaces, and so now the hand is contaminated with the virus, and then they touched their nose, mouth, or their eyes, they can also get infected. It's been reported, and there are reports now of the possible aerosol and fecal oral transmission of the virus. As we will see, or as we will discuss later, okay, the aerosol transmission of the disease is something very serious, very worrying to us as dentists, because of the nature of our practice and because of the highly chance of the generation of aerosols during many dental procedures. So aerosols, الفرق أو the main difference between aerosols and droplets is that we'll discuss that in detail in a few minutes. But what we need to know now that aerosol اللي هو الرذاذ, it can remain in air for longer period and travel for longer distance. Fecal oral transmission, it's been reported that the virus has been found in the stool of a patient, of an infected patient, and thus we need to emphasize here the utmost importance of hand hygiene in order to prevent this type of transmission of the virus. Okay, now let's be now more specific and talk about the possible transmission routes of novel coronavirus, especially or in particular in the dental practice. The most common way or the main way for the spread of the virus in dental practice will be always airborne spread. And here in airborne spread, we mean spreading of the virus in aerosols and droplets. And again, we know that when the handpiece, high-speed handpiece is used, or when ultrasonic scaler is used, the droplets and aerosols will be definitely generated. And that's why we know that most of our work depends on the use of the high-speed handpiece. And we know that using high-speed handpiece will generate aerosols. And this is the main way for the spread of the disease in dental practice. And this is going to be our main point for the discussion, how to reduce the generation of aerosols and droplets during dental practice, especially during the outbreak, where the chances of infection are really high. Contact spread, as I said, direct or indirect. Direct by we know that when we treat patients in dental practice, we are very close to them, physically close to them, and so splashes with droplets and aerosols might directly enter our body through the mucous membranes of the eyes, mouth, or the nose. Or as I said, when the virus is finally on the ground or surfaces, if we contacted these contaminated surfaces with our hands, or these contaminated instruments with our hand, and then we touched our nose, eyes, or mouth with the hand, then we can also get infected. Okay, or with the contact with the patient fluids, saliva. It's now it's confirmed that the virus is present in saliva, and so we can have again, if our hands or gloves infected with saliva, and then we touched any of the mucous membranes in the nose, mouth, and eyes, we can get infected. Now, contaminated surfaces. Here, it is interesting and worrying, actually, at the same time, that novel coronavirus can persist on surfaces like metal, plastic, or glass up to 9 days. So these surfaces that are contaminated with the virus can, as I said, can be infectious and can transmit the virus up to 9 days. And here we need to emphasize the importance of cleaning and disinfection of the surfaces of the surrounding in the dental practice in order to prevent this type of spread of novel coronavirus 2019. Okay, as I mentioned earlier, that now we all know the main worry, the main concern to us as dentists is the airborne transmission of novel coronavirus, which can be through either droplets or aerosols. Okay. Now, the main difference, because as we all know that using let's say many of the dental procedures, especially when the use of hand ease, or when we use high-speed hand ease, or when we use ultrasonic scaler, both droplets and aerosols will be generated. Now, why aerosols, let's say, are more dangerous than droplets? Because droplets are usually of larger diameter particles. We are talking here about a particle which are more than 5 micrometer in diameter. So if we don't inhale the droplet directly from the patient, and this needs physical proximity between an infected patient and a susceptible individual, which can be the dentist, of course. So if we don't inhale it, or if we don't get it, let's say, direct by direct contact with the nose, mouth, or eyes, okay, the droplet will fall into the ground or into the surfaces. But in aerosols, here we are talking about smaller diameter particles. Here we are talking about particles that are less than 5 micrometer in diameter. These particles can remain longer in the air. They can remain in the air for longer time, and they can travel for longer distances. We are talking about at least 2 meters. And so they can spread the virus for a longer distance. And if we are talking about dental practice, the generation of the aerosols will make, let's say, the whole environment of the dental practice infectious. So if we are treating an infectious patient, and then aerosols are generated, here it's not only about the inhalation or the direct contact of the virus with the mucous membranes of the dentist or the dental staff. Here we are talking about the environment will be, or the whole room will be infected, and thus the virus will be around in all the practice or in the whole area, and so it can spread the infection really to many people, patients, staff, dental practitioners, especially that the virus can remain up to 3 hours in the air, and so it can infect more and more people. So this is really serious and worrying, and we need to give it, like let's say, big big consideration, and we need to like make sure or try our best not to use the high-speed handpiece, or not to go for procedures that can generate aerosols, especially during the pandemic where the chances of infection are really high. تمام. راح نرجع. كيف الأمور؟ موجودين كلنا موجودين كمان. إذا واضح الأمور لحديت هلا، الصوت واضح والأمور واضحة. تمام. ذهب هذا. تمام. يلا يعطيك العافية. أوكي، نكمل. هلا هاي this figure shows us again the اوكي شوف بس ليش. اوكي تمام. Okay, so this figure shows us again the possibles or the possible ways of transmission of the virus in dental practice. So we know again, if I have an infected patient, hope we are not going to have any infected patient because this is really serious. But if we have it and if we are treating an infected patient and then if we didn't follow strict infection control measures while using the high-speed handpiece, aerosols and droplets will be generated. These can infect dental professionals and staff by inhalation or in direct contact with the eyes, nose, and mucosa, or with the mucous membranes of the eyes, nose, and mouth, or again indirectly after the droplet falls, after droplets fall into the ground and the surfaces and the surfaces are now contaminated. Again, the infected patient, if we talk about susceptible individuals, can usually transmit the disease, airborne transmission when they cough or sneeze, and then the susceptible individual inhale the droplets that contain the virus. So this clarifies to us that we are at higher risk to get infected than let's say than other people, and so we need to take extra protective measures in order not to get infected or transmit the infection. Okay, so here I quote a sentence from a paper published in Wuhan, China. It was published by dental practitioners working in dental hospital in Wuhan, China. Their advice to us, due to the unique characteristics of dental procedures, where a large number of droplets and aerosols could be generated, as we discussed, the standard protective measures in daily clinical work are not effective enough to prevent the spread of COVID-19, especially when patients are in an incubation period, are unaware they are infected, or choose to conceal their infection. So now we all agree that the chance to get infected is due to the nature of our practice, is due to the high chance of the generation of aerosols and droplets. So the chance to get infected if we are treating an infected patient is really high, and thus we need to follow very strict infection control measures. Okay, two things that make us really serious about it. The first thing, the nature of our practice, and the second thing, that many patients can have the infection, can be infectious, can be contagious, but because we are talking about a long incubation period in this disease, the symptoms can not appear for up to 14 days, or maybe sometimes the patient will choose to conceal their infection, and so sometimes it's difficult to identify infected patient. And so during the outbreak, okay, and even after the outbreak, especially let's say the first month after the outbreak, we need to be very careful. We need to follow very strict infection control measures, and we need to make sure that we are able to identify suspected cases. And even if we don't identify the case, we follow very strict measures as the patient is infected. Because, as we said, the incubation period is long, and so the patient can be asymptomatic doesn't have any symptoms but still infectious. Okay, so what should dentists do? First, they should stop doing elective procedure during the pandemic. Now, as we know, the disease is spread. Many people are infected, and so many people are, or many patients are infectious, and like transmission of the disease can be really easy. And so during this period, we need to stop doing any elective procedures because the chance to get infected is really high, and limit the treatments we provide only to emergencies and urgent cases. We'll discuss the list of dental emergencies and urgent cases as published by the American Dental Association. We need to implement strict infection prevention and control measures, and as I said, this should be done or should be implemented not only during the pandemic but also after the pandemic, at least the first months after the pandemic, until we are sure that the virus is not any longer a risk to us. Okay, so dentists have a big and important role in control and prevention of transmission of the disease. We all should know how does novel coronavirus 19 spread, and now we all know that, and we know that the main route of its transmission is airborne spread through droplets and aerosols, and we are also aware of the other ways of its transmission, like the contact transmission, direct or indirect, and the contact with contaminated surfaces. We need also to know how to identify infected or possibly infected patients. We talk about that in detail in the next part of the lecture. And what are the measures and the important measures we need to implement in our practice during and after the pandemic to prevent and control transmission of the disease. Maybe the first quotation was a bit not optimistic, but again, here's another quotation from the same paper, but this one is more optimistic. It shows us how following strict infection control measures can really save us from risk of infection and risk of transmission of disease. Here, the authors reported that despite the increasing number of confirmed cases during this period in Wuhan, we, 169 staff involved in duty of dental emergency, have treated more than 700 patients with emergent dental treatment needs since January 24. So they are talking about, since that the paper was published in the end of February, so they are talking about a month, 1 month work. So they treated more than 700 patients in 1 month under the premise of adequate protection measures, and during this month no further COVID-19 infection has been reported among our staff, which confirmed the effectiveness of our infection control measures in COVID-19 prevention within dental settings. So if we follow really strict infection control measures, even if we treat infected patients, we are hopefully safe. So what are the measures we need to follow, and how we can implement them in our practice? Many measures, some of them are related to patient evaluation, hand hygiene, personal protective equipment, mouth rinse before procedures, rubber dam isolation and forehand technique dentistry, anti-retraction handpiece, extraoral x-rays as alternatives to intraoral, disinfection of the clinic setting, and management of medical waste. We'll go through them now in detail and discuss how these measures can be implemented in our practice. تمام، امورنا تمام، بعدنا موجودين، كله واضح، كل شيء كويس. انا هيك بحب اخذ بريكس، برجع على الشاشه وبتاكد انه الامور تمام. فبستنى كومنت من حدا عشان أكمل. شكرا يا دكتورة صلاح. تمام. اوكي. فهلا we will start to discuss how the measures can be implemented. Okay. First one, patient evaluation. So the dental professional should be able to identify a suspected case of COVID-19. Okay. In general, patients with confirmed COVID-19 disease, or if they come to our practice in the, let's say, acute phase of the disease, these should not be treated. Okay? Now, so the patients in the acute phase of the disease should not be treated unless if it's really an emergency or something very urgent, then we need to consider treating them with taking into consideration that they are infected and they are contagious. So we need to implement very strict infection control measures. Now, so this kind of patient, as I said, is better not to be treated. They should not be treated. Now, let's discuss how to identify suspected cases of COVID-19. The main indicator or the main thing we need to do is to measure the body temperature of the patient. And here it's always safer to use a contact-free forehead thermometer for cross-infection reasons and to prevent the transmission of the disease if we use like the normal thermometer. Okay, so we measure body temperature. We find out if the patient has any respiratory problems like coughing and sneezing, and then the patient will be asked to complete a questionnaire used to screen the patients. This questionnaire will include questions about fever and the history of fever within the past 14 days. We need to ask the patient if they experienced any fever in the last 14 days, if they have or if they had respiratory problems within the past 14 days, like coughing or sneezing, if they traveled to an affected region where the virus is known to be spread, if they contacted patients with confirmed infection, and if they participated in big gatherings where they met, let's say, big number of people who they don't know. Okay, so how to identify or how, let's say, to categorize the cases we have. Now, if we measure the temperature of a patient and it was high, more than 37, and then if the patient answered yes to one of the questions, and so we have fever plus one or more clues, then we consider the case as a suspected case, and here we need to immediately quarantine the patient and report to the infection control department. And of course, the patient should not be treated. Now, if the patient has fever but didn't answer yes to any of the questions, and so we don't have any clue other than the fever, in that case, we also don't treat the patient and we refer him to a fever or COVID-19 clinic for extra or for more tests to confirm if the patient is infected or not. Now, if the patient, let's say, if the temperature of the body, if the temperature was not high, less than 37, and the patient answered yes to one or more of the questions, here it's better to defer the treatment, postpone the treatment, and ask the patient to self-quarantine themselves for 14 days until they make sure that they don't have symptoms, and then they come back for treatment. So these are the main three scenarios that we can have in the clinic. We need to be really cautious not to miss any suspected case. But as I mentioned in the beginning, okay, these infection control measures should be followed during the pandemic. And for us, when we resume our practice and start doing routine procedures, we need to follow the same measures, okay, during the first month of after the pandemic or after the outbreak, and until we are sure that the virus is no longer a risk to us. Okay. Hand hygiene. Here, as we said, since that it was confirmed that the virus can be present in stool of the patient, so hand hygiene is very important to prevent this type of the transmission, possible fecal oral transmission, and also to prevent contact transmission, of course. Here, when we talk about indirect contact, when we touch contaminated surfaces or instruments with the virus. So, maintaining good hand hygiene measures will prevent fecal oral transmission and will also prevent contact or indirect contact transmission. So we need to make sure also we don't touch eyes, mouth, and nose, because as I said, the virus can be transmitted after touching a contaminated surface and then touching the mucous membranes of the eyes, mouth, and nose, and so the virus can enter our body. One of the, let's say, agreed guideline for hand hygiene is 2 before and 3 after hand hygiene guideline. So in dental practice, we follow this guideline where we need to wash our hand before touching the patient, before examination or touching the patient, before doing any dental procedure, after being exposed to dental fluids, after touching a patient, and or after touching a patient's surrounding. So we need to maintain very good hand hygiene measures. اوكي تمام، كنا موجودين. اوكي، خلينا بس بريك 2 minutes، راجع بس اشرب مي. So I'm back. تمام. على قلبكم يسلموا يسلموا. شكرا شكرا. تمام. راح ارجع هلا للهاند اوت. اوكي. ف كمل. تمام. Okay, so we discussed so far patient or evaluation of patients and okay, so the screen, okay, evaluation of patients and hand hygiene. The next infection control measure we are going to talk about, which is really very important, is personal protective equipment. As we all know that now that the main way of transmission of the virus, especially in the dental practice, is airborne through droplets and aerosols, then we need to have good protection against transmission of the virus through droplets and aerosols. Now, barrier protection equipment, including goggles for eye protection, masks, it can be surgical or face mask, the normal face mask, or N95, gloves, caps, face shield, and protective outwear is strongly recommended. Now, when we talk about masks, as you can see here in the top photo, this is a surgical or face mask, and in the bottom photo, a 95 mask. Which one is better? Of course, N95 is better and provides better protection. It will achieve a good fit and good seal around the nose and the mouth, and also it blocks nearly 95 small particles as small as 0.3 microns. Whereas the surgical mask or the normal face mask will only block and protect us from big particles, and also it doesn't have or doesn't provide a good seal around the nose and mouth. So if we have the option or the choice, it's better always and safer to go for the N95 mask. Now, in the or during the pandemic, or as I said, in the first months after the pandemic, since the risks will be still there, one of the thing or recommended thing is to always wear protective outwear. So over your scrub or white coat, you need to wear protective outwear, disposable. So you dispose it after treating each patient or after treating patients to protect yourself. Okay, so all the parts of the personal protective equipment, including the goggles for eye protection, masks to protect us from droplet and aerosol transmission of the disease, gloves to prevent like transmission of the disease through indirect contact after contact with contaminated surfaces or instruments. Caps are also important to protect the hair because we know that droplets and aerosols can fall into hair, and then hair becomes also infectious. Face shield to protect our mouth, eyes, and nose, and this will protect us from the direct contact transmission of the virus through droplets and aerosols again. Okay, so we need to make sure that we wear all of these to protect us from the virus. Okay, let's move to the next infection control measure, which is mouth rinse. Now it's believed that pre-procedural antimicrobial mouthwash can reduce the number of microbes in saliva, and we all know that the virus is present in saliva, and so the microbial and mouth rinse or mouthwash can help us to reduce the chance of transmission of infection, as it reduces and kills this big number of microbes in the saliva, including bacteria and viruses. If we want to be more specific about coronavirus, we know that the most commonly used mouth rinse or wash in dental practices is a chlorhexidine. Chlorhexidine actually may not be effective to kill the coronavirus. The better option would be a mouth rinse that contains oxidative agents such as 1% hydrogen peroxide or 0.2% bovidone, which is iodine. Now, these are more recommended as it's believed that the virus is vulnerable to oxidation, and so these oxidative agents in these mouth rinses can oxidate the virus and kill the viruses. From the common available mouth rinses, for like the one that contains hydrogen peroxide, one of the known ones is HPM mouth rinse, and betadine, the one that contains bovidone or iodine. Okay, next, infection control measures: rubber dam isolation, forehand technique, low and high volume suction. Now, again, the main transmission route is aerosols and droplets, and so like we need to implement all the techniques and all the ways to reduce the generation of the aerosols and droplets. The use of rubber dam will definitely reduce and minimize the production of saliva and blood contaminated aerosols. And we know that aerosols will be generated especially when high-speed handpieces or ultrasonic devices are used. There is a study that reported a reduction of airborne particle by 70% in approximately 1 meter diameter operational field when the rubber dam is used, which is a significant reduction, but of course is not sufficient. So we need to combine the use of rubber dam, or of course it doesn't, like, let's say, completely eliminate the particles in the air. So in addition to rubber dam, we should combine it with high and low volume suction, and we should also implement the four-handed technique dentistry for maximum infection control. Because when we implement the four-handed technique, first we can use high and low volume suction at the same time, and also we can reduce the chance of the, let's say, contact of the dentist touching more instruments or more surfaces, and then they can be contaminated with the virus. So four-handed technique dentistry is recommended for maximum infection control. Okay, so we know that, as we just discussed, it's recommended to go and to use the rubber dam, but sometimes in some procedures the use of rubber dam can be difficult. So if we don't use it, we should aim for, let's say, maximum infection control measures, and there are some, let's say, advices for different specialties. They are summarized in this table. So for endodontics, as we said, rubber dam must be applied during endo treatment. Okay, and as we said, since that RCT treatment requires a number of endodontic instruments and devices, we should implement four-handed technique to minimize unnecessary hand contact with surfaces and equipment in the dental office to reduce the possibility of formite transmission. Formite means surfaces transmission. So the transmission of the virus via contact with contaminated surfaces. It can be metal, plastic, or glass, etc. In restorative dentistry and pediatric dentistry, we should avoid using rotary instruments such as high-speed handpiece during cavity preparation. So it would be safer, for example, if we talk about caries removal, it would be safer to go for to chemico-mechanical technique for the caries removal using a material such as Carisol. This will be safer than using a high-speed handpiece during the pandemic. And as I said, I keep saying it's not only during the pandemic or during the outbreak, but also for the at least first month after the pandemic, where the virus will be still there and where the risk from the virus will be still there. Okay. In periodontics, we know that one of the devices that can also generate aerosols and droplets is the ultrasonic scaler. So for removing plaque and calculus, it would be safer during this period to go for manual scaling using manual scalers to remove the calculus and plaque instead of the ultrasonic device. In the prosthodontics, we need to make sure that saliva resection is used, and especially during taking impressions, for example, to reduce the gagging. When we take impressions, we need to select the appropriate size of the trays in order to avoid, again, gagging. If the patient is known to have a severe gag response, then it would be a good idea to use local anesthesia applied to the throat before impression taking. During crown prep, since that like using rubber dam and preparing equi or subgingival finish line would be really difficult while using rubber dam, it would be safer to go for a supragingival margin and use the rubber dam. But if you want to prepare, like say equi or subgingival, you can use the split dam technique. Again, as we talked in endo, where the dentist needs to contact many, let's say, instrument and devices during try-in of complete denture or partial denture, make sure that you implement four-handed dentistry, and thus you can minimize the contact with the subject or the surfaces and then transmit the virus to these surfaces. And also, after using the materials in prosthodontics clinics, which can be many materials, make sure that you follow strict infection control measure and you disinfect the materials with appropriate material and technique. In surgery, one of the recommendations is to place or treat the patient in supine position while, for example, doing extraction in order to not to block the airway of the patient and thus avoid any like coughing or sneezing or gagging of the patient. So we discussed so far the patient evaluation, hand hygiene, personal protective equipment, rubber dam isolation, four-handed technique, low and high volume suction. One more infection control measure is the use of anti-retraction handpiece. Now, high-speed dental hand pieces can be either with anti-retraction valve or anti-reflux system or without it. Of course, it's recommended to use the handpieces with anti-retraction valves because the ones without can aspirate and expel the debris and fluid during dental procedures. And so the microbes may contaminate the, let's say, there will be more infected aerosols and droplets generated. And also the microbes can contaminate the air and water tube within the dental unit. In a study about the effectiveness of anti-retraction high-speed handpiece, they found that the use of anti-retraction high-speed handpiece can significantly reduce the backflow of oral bacteria and hepatitis B virus into the tubes of the handpiece and a dental unit, and thus actually during this time, in the pandemic time, and where the chances for transmission of infection are really high, I would always go for a handpiece with anti-retraction design. And actually, I think that the use of the ones without anti-retraction valves should be inhibited or should be prohibited. Okay. One more infection control measure: extraoral X-rays as alternative to intraoral. Now we all know that intraoral radiography is not that pleasant to the patient. It might stimulate saliva secretion, and it might also stimulate gagging or coughing. And thus it would be safer to go for, in order to reduce the generation of aerosols and droplets again, by coughing or by coughing or sneezing or by irritation during intraoral radiography. And also, as we said, the intraoral radiography can stimulate saliva secretion, and we know that the virus is present in saliva, and so we will be, or this will increase the chances for transmission of the virus to the dentist and the dental staff. So it would be safer to go for extraoral radiographs as alternatives to the intraoral, such as panoramic radiography and cone beam CT, computed tomography. Okay. Disinfection of the clinic setting. Of course, we need to follow strict disinfection measures in both the clinic setting and public area. The clinic setting should be cleaned and disinfected in accordance with the protocol. Public areas and appliances should be frequently cleaned and disinfected, including door handles, chairs, and desks. Public areas and the clinic should be well ventilated. And actually, this is an important point about the ventilation. It has been found in a study that the virus can persist on surfaces for longer in a humid environment. So they compared like 30% versus 50% humidity, and they found that the virus can persist for longer period when the humidity is 50%. And so keeping the public areas and the clinic well ventilated, dry, and clean will help to reduce the persistence of the virus on surfaces. And we know that this is something we need to consider, and we need to give it good consideration, because the virus can persist on some surfaces up to 9 days. Patient in waiting area should wear shoe covers and face masks. So when the patients wear shoe covers, they will make sure that the virus is not transmitted from outside into the clinic, because we know in the end the droplets containing the viruses will fall onto the ground, and the virus will persist for some time, and so the virus can be transmitted by shoes. So wearing shoe covers will protect us from this kind of transmission. The elevator should be disinfected regularly. People taking elevator should wear masks and avoid direct contact with buttons and other objects. And of course, people should try not to cough or sneeze in the elevator, because this will increase the chance of transmission of the virus by inhalation, which is considered as direct transmission of the virus. Management of medical waste. So medical waste, including disposable protective equipment after use, should be transported to a designated storage area. The instruments which are reusable should be pre-treated, cleaned, sterilized, and properly stored in accordance with the protocol for disinfection and sterilization of dental instruments. Medical and domestic waste generated by the treatment of patients with suspected or confirmed coronavirus should be regarded as infectious medical waste and should be stored and disposed of as such. So we need to take it, be really cautious, and especially when we treat like suspected or confirmed cases with coronavirus 2019 and consider the, let's say, the waste as infectious waste and dispose it accordingly. Okay, so now we discussed the main points and the main infection control measures that we should or we must actually follow during the pandemic and first month after the pandemic until the virus is no longer a risk. So during the pandemic, what dentists should do, they should stop elective procedures. They should treat only dental emergencies and urgent cases. And they should make sure that they implement strict infection control measures. Okay. After the pandemic, I suggest or like to gradually start more routine procedures, and of course to continue to implement strict infection control measures, as I said, because the virus will be a risk for a good number of months after the pandemic. Now, why do I suggest to gradually start more routine procedures? As we will discuss later, for two main points. The first one is when you resume your work, if the practice was really busy, you can't ensure that you can maintain high standard and strict infection control measures. And the other thing, the practice can be really crowded, and this will increase the chance of infection. So it would be better when we resume the work, to do it gradually, so we can maintain the strict infection control measures we have to follow in this period. Okay, so as we said in the beginning, during the pandemic, we can treat both dental emergencies and urgent cases. Okay, we need to follow the strict infection control measures during the treatment of the patient. We need to be able to identify suspected cases, and an important thing and an important point, these measures we just discussed are not only for during the pandemic, but also for after the pandemic, as I said again, when the virus is still a risk. Okay. Now, the dental emergencies and urgent cases, according to American Dental Association, starting with dental emergencies, they are the potentially life-threatening and require immediate treatment to stop ongoing tissue bleeding and to alleviate severe pain or infection. So these include uncontrolled bleeding, cellulitis or a diffuse soft bacterial infection, infection with swelling that compromises the patient's airway, and trauma involving facial bones. Urgent cases include severe dental pain from pulpal inflammation, pericoronitis or third molar pain, surgical post-operative osteitis, trisocotrizine changes, abscess or localized bacterial infection resulting in localized pain and swelling, tooth fracture resulting in pain or causing soft tissue trauma, tooth trauma with avulsion or luxation, dental treatment required prior to critical medical procedure, like for example extraction before surgical excision of a tumor. Finally, crown bridge cementation if the temporal restoration is lost, broken, or causing gingival irritation. Urgent cases also include extensive dental caries causing pain, defective restorations again causing pain, and here repairing, or let's say this restoration or restoring the cavities should be as minimally invasive as possible. We should try to stick to using manual devices, avoid using let's say high-speed handpieces, especially during the pandemic, because again we don't want any procedure that might produce aerosols or the droplets, and we can use materials such as glass armor for the restorations. Urgent cases also include suture removal, denture adjustment for radiation or oncology patients, denture adjustment or repair when function is impeded, the patient can't eat, for example, replacing temporary filling on endo-access opening in patient experiencing pain, snipping or adjustment of an orthodontic wire or appliance, piercing or alterating the oral mucosa, and biopsy of abnormal tissue. And here it's really important not to miss the diagnosis of it might be, as you know, cancerous tissue. So we need to take biopsy and not to postpone this procedure. Okay. Recommendations for the dental education during the pandemic. Of course, like it's a good chance for distance learning. So we need to make sure we use like distance learning resources and apply and implement distance learning. These include online lectures, case studies, problem-based learning, tutorials. They all should be adopted to avoid unnecessary aggregation of people and the associated risk of infection transmission. It's also good during this period to encourage students to engage in self-learning and make full use of online resources. Now, something really important to talk about, psychological preparation and support to students. After the pandemic, there's something really important to consider, is the fear or the what we call it disease-associated fear and pressure. Many of the students will have fear and pressure, fear from getting the infection, and so they might not be prepared or they will be reluctant to perform any dental procedure or any medical procedure if they are medical students, because they will always have the worry and the fear of getting the infection. And here it's our role in dental education to provide the sufficient and the appropriate psychological preparation and support to students before commencing or before resume practice again. So, you know, in the end of lectures, one of the most important part is the take-home message or the take-home messages. But today, it's not take-home messages, it's stay-home messages. So the most important messages or recommendation. My recommendations actually, according to my reading and understanding, based on the characteristics of novel coronavirus 2019, the routes of transmission and the likely production of droplets and aerosols in many dental procedures, we all know that dentists are at very high risk to get infected and transmit the disease during their practice. Thus, during the pandemic, work should be limited to emergencies and urgent care, and strict infection control measures must be implemented. But these measures must be implemented not only during the pandemic, but also first month after the pandemic, when the risk of the virus infection and transmission will be really high. Dentists continue to implement strict infection control measures after the outbreak and prioritize their role in the control and prevention of infection and transmission of disease. It's recommended to gradually increase the number of patients seen and routine procedure to ensure that high standards and strict infection control measures can be maintained for the longest possible period and to avoid crowding in waiting areas. Again, I think this is an important point. If we resume our work and if we start seeing big number of patients from day one after we resume our work, this means two things. The first thing, that we'll try to be really fast doing the procedures, and thus maintaining high standard of infection control measures can become really difficult. Whereas if I start with like small number of patients and cases, then I can maintain that the high standard and the strict infection control measures can be maintained until actually I think with time, okay, we'll get used to these strict infection control measures, and we can become more efficient and faster in implementing these measures, and so we can gradually increase the number of patients with maintaining the implementation of the measures. And also during the first period after the pandemic, we need to avoid crowding in waiting areas, and thus it would be better to gradually increase, as we say, the number of patients seen in the clinic. As in crowding, there will be higher chance for the transmission of infection. وهيك بنكون these are the references with the links used for preparation of the lecture. And finally أهلنا بإربد، الله يحميكم جميعا، وإن شاء الله يكون الجميع بصحة وخير بأمان، يحمينا من هالمرض في كل أنحاء العالم، وإن شاء الله ما حدا فينا بيشوف شر لا فيه أو بأهله أو بكل أصدقائه وكل الناس اللي بحبهم. Thank you very much for listening. هلا راح أرجع على السكرين، تمام؟ وهنا ثواني، الله يعافيكم يا رب، يعطيكم ألف عافية، إن شاء الله تكونوا كلكم بخير، تكونوا بصحة وأمان. في حدا عنده أي استفسار؟ Do you have any questions, guys? Please feel free to ask or raise any points. الله يعطيكم العافية جميعا، وشكرا لكم وشكرا لحضوركم. Thank you for joining us. أنا معكم بعدني هون عم بشوف الكومنتس تبعونكم. شكرا كثير لكم. إذا في أي حدا عنده أي استفسار please don't hesitate to ask. الله يعافيكم يا رب. محمد رحمة خليل محمد هذا question. شو سؤالك يا محمد؟ بدك ريته رحمة؟ Okay محمد, you can ask again, or رحمة you can put that question for him. الله يعافيك صديقي فهد. الله يعافيك أسامة. أهلا نبين دكتورة نبين دكتور علي دكتور محمد. شو سؤالك كان؟ طب إيناس دكتور متى بتتوقع كمدة إنه ممكن نشتغل روتين بروسيجر من غير ما نكون خايفين؟ هلا I think يعني زي ما بيحكوا إنه العالم راح يكون after corona different from before corona. إيناس I think this also applies to dentistry. So dentistry after corona will be different than or from before corona. بتخيل إنه the infection control measures we just discussed should be implemented and we يعني should يعني keep high standard of infection control for really long period. يعني maybe يعني هلا يعني I think it's good thing actually to يعني implement these measures in our practice because it will not only protect us from getting infected with COVID-19 but it will also protect us from other types of infection. لكن هل لمتى أو لازم نضلنا خايفين من الكوفيد-19؟ I think يعني it will take يعني months if not years hopefully. تمام. خليني أشوف كان في سؤال. هلا زي ما حكينا نحن بنتذكر إنه يعني دكتورة لين إنه هلا خلينا نفترض even if they announce in Jordan that يعني we have treated the last case and now يعني there is no patient or no infected patient in Jordan. هلا احنا بنعرف انه بعدين مثلا راح يرجعوا they will open يعني airports again, many people يعني can travel from and to Jordan, وبالتالي they can transmit the virus again. وبالتالي يعني I think, as I said, nothing is called safe from the infection. We need to always follow the very strict infection control measures, the ones we discussed, for really long period of time. هلا كان سؤالك as students صراحة في big concern أو important point بتعلق باللي هو dental center وبالstudents إنه إحنا in dental center it's busy and crowded, and this makes the environment more يعني أو the chances for transmission of infection higher. وبالتالي I think يعني we need to take extra protective measures in the dental center or in the, let's say, training centers where we have big number of students and of course big number of patients treated at the same time. أكيد دكتور يحيى، اللي بدك إياه أنت اختار الموضوع إن شاء الله بنرتبه. طيب هلا الهاند اوت يا دكتور محمد already available. I posted يعني yesterday إنه I posted a status with link for هاي رحمة جاوبتني already ورشا، شكرا دكتورات. You can see the link for Google Drive where you can get the handout and the references as well. أكيد ما في أي مشكلة دكتورة إيناس، بنرتب إن شاء الله. وفي أنا يعني مع ال 4th year students كمان عم نرتب لمحاضرات لايف أونلاين، ممكن إن شاء الله نرتب لهم. تمام، يلا يعطيكم ألف عافية و take care, stay safe everyone. الله يحميكم جميعا وشكرا كثير. Thank you for joining us. وشكرا كثير مرة ثانية. Thank you Jazz, thank you Rasha for the invitation. الله يحميكم جميعا. All the best to everyone. يعطيكم العافية. في سؤال نور. Look, if the brief is dislodged and have pain, what should we do? Now, this is considered, Dr. Noor, as an urgent case. So, if we are talking, if you mean during the pandemic, yes, we treat it because it's considered as an urgent case. So, we treat it, but again, with implementing very strict infection control measures. يلا يعطيكم العافية، شكرا كثير.